Okay, dah record eh? Okay. Good day, everyone, and welcome to our forum on good health and well-being. We will focus on mental health awareness and support. Mental health is a critical part of our overall health, yet it is often misunderstood, ignored, or stigmatized. So today, we will explore different aspects of mental health, such as depressions, challenge, challenges faced by adolescents, the effect on social media, the role of therapy, and how stigma can prevent people from getting help. This topic is especially relevant to youth and communities lead. According to the World Health Organizations in 2022, one in every 8 people worldwide live with a mental health disorder, and most go untreated. Mental health issues such as anxiety, depressions, and stress are becoming more common, especially among adolescents and young adults. It is important to talk about this issue openly, understand the risks and causes, and support those in need. Together, we will discuss how to reduce stigma, raise awareness, and promote access to mental health resources so that we can create a supportive environment for everyone. But before we begin, I will give a moment for our five incredible panelists today to introduce yourself. You may start.
Hi, everyone. I'll be the first panelist in our panel discussion.
Hi, I'm Yin, and I will be the second panelist for our panel discussion.
Hi, I am the third panelist for this discussion.
Hi everyone, my name is Yipwa Yi, and I will be the fourth panelist of this panel discussion.
Hi, my name is Muhammad Aziz Aiman, and I will be the fifth panelist for this forum.
Okay, so there are five panelists for today. So now let's begin with our topic. Let's start with the basic. On Jingwen, many people still misunderstand what depression really is. Could you help us understand what is depression and what are the symptoms we should be aware of?
Sure. Thank you for the question. So, depression is a serious mood disorder and a medical condition that affect how the person feel, thinks, and handle daily activities. Not just feeling down or going through a low pitch. Depression can interfere with a person's ability to function in everyday life, and in more severe cases, it may even lead to a serious health issue if left untreated. So when we talk about the symptom of depression, they can vary from person to person, but there are some common signs to look out for. Generally, someone who is experiencing depression may show symptoms such as anxiety. This is more than just nervousness. It is a constant sense of worry or unease that does not go away and may interfere with decision making or even daily tasks. Second, the symptom of depression can be shown that have a feeling of sadness. It is not just feeling down for a day or two, but a deep, lasting sadness that can continue for weeks or longer. In some cases, depression may not present as sadness, but instead as angry opens. Small issue can trigger intense reaction, making it harder for the individual to maintain the function normally. Another key indicator is loss of interest. Things that the person used to enjoy, like their hobbies, socializing, or even food, may no longer bring joy or motivation. For teenagers, The symptom can appear a bit differently. One of the early warning signs is they're refusing to go to the school. This could be a sign that they are struggling emotionally or mentally, and do not feel safe or motivated in their usual environment. Some teenagers may also show clinginess, that becoming unusually attracted to parents or caregiver. They are seeking constant reassurance or attention. Another sign is the presence of aches and pain, such as heel aches or stomach ache. This without any clear medical explanation. These physical complaints can be the body ways of experiencing emotional pains. In addition, teenagers may develop bad habits. This could include unhealthy coping behavior like skipping meals, avoiding sleep, or even turning to social withdrawal or risk-taking action. Recognize this sign early is crucial. Sometimes people don't even realize they are going through depression, especially when the symptoms come on gradually. That's why understanding what to look out for can help us support ourselves and others better. In short, depression is not just a temporary emotional state, it's a real and serious health condition that deserves attention and care. If someone shows this symptom for more than a couple of weeks, it is important to take it seriously and encourage them to seek help from a medical or mental health professional. So that's all for me. Thank you.
That was very informative. It's important we all recognize the sign early, especially in ourselves or our loved ones. So, moving on to pain, we often hear that adolescents are at high risk of mental health issues. What are the risk factors that make adolescents more vulnerable to mental health problems?
Thank you for the question. And adolescents face different risks that can make them more vulnerable to the mental health problem. And one of it is the individual characterism, which is a self-esteem. Self-esteem is one overall attitude and evaluations toward the self which represent the self-concept and self-worth. Adolescents with a lower self-esteem are tend to underestimate their ability when encounter difficulty and are more frequently felt frustrated. And being immersed in an adverse appraisal to the self will lead to a depressive symptom and even prolonged depressions. The predictiveness of self-esteem on a depressions was tested among 351 adolescents. The result revealed that teenagers who score lower on a self-esteem are more likely to have a higher level of anxiety, depressions, and also a lower level of overall mental well-being. And besides that, another major risk factor is the family environment, include the adverse childhood experience, which is ACEs. A child early environment play a big role in shaping their physical and mental health. Experiencing a traumatic event such as the domestic violence, child abuse, and the frequent family conflict can weaken a child's mental strength and make them more likely to develop depressions later in life. Teenagers with a numerous ACEs are reported 3 to 15 times more likely to having a various health event, such as a cognitive difficulty, depressed mood, self-injury behavior, and suicidal ideations when the several demographic variables were controlled. And finally, is the peer relationship will affect the adolescent's mental health. Peer relationship include Peer relationship involve the dimensions of acceptance, intimacy establishment, and the trustworthiness among peers, which are essential for the adolescent's psychological health. Adolescents with a poorest peer relationship as well as lack of school connectedness reported the worst outcome related to depressions, anxiety, and overall well-being. The primary pathway through the peer relations its effect the mental health is social support. Adolescents with a poor peer relationship will have a less social support, daily entertainment resources, and a companionship, which are leading to a negative emotional state. Prolonged exposure to this negative state will elicit a stress response and can contribute to depressions and anxiety in adolescents. And these are among the most popular risk factor that causes the mental health issue among the adolescents. And maybe we can pay more attention to these risks so that the adolescents um so that we can reduce the mental health problem among the adolescents. That's all from me. Thank you.
Thank you, Paying. That really highlights how a supportive environment can make a big difference for young people. So now, Christina, social media play a huge part in young life today. Maybe you can explain how does social media increase the risk of anxiety and depression among teenagers?
Yeah, thank you, Alicia. So now I'm going to explain about the how social media use increase the risk of anxiety and depression. Okay, according to the research, over 50% of adolescents report feeling anxious or depressed after using social media. And those who using social media more than 5 hours daily are 2.8 times more likely to develop depression. Okay, young people may be put in danger by the peer pressure that can be found on social networking platform. This can take the form of being rejected by peers, engaging in online fight, or being involved in drama or conflict. This is because young people nowadays more likely to be influenced by social media. Peer influence process may also be amplified among teenagers who spend time online where they have access to a wider diversity of ideas as well as content that can damaging to them. If young people are exposed to information on social media that despite risky behavior, like likelihood or engaging in such behavior themselves, such as taking drugs, may increase. It may be simple to gain access to online material that deals with self-harm and suicide, and also anxiety and depression, which may result in a higher suicide result. A recent study found that 80.8% of young people who were admitted to mental hospital because they pose a risk to others of themselves because they see a fighting scene on the online social media and they want to try them. But due to the parent not allowing them, they become um, angry and showing a bad behavior. This influence made people, especially adolescents, having a bad behavior towards their parent and have a bad appearance. Okay, that's all from me. Thank you.
Thank you, Christina. A very eye-opening explanations. Clearly, it's not just about screen time, but also paying emotional impact to adolescents. So when we talk about mental health problem, we should also talk about the therapy. So now let's talk about the therapy. Why, from your research, how can therapy help individuals recover from mental health challenges like depressions and anxiety?
Thank you to our moderator. So therapy can help individual recover from mental health issues because therapy helps to provide a reliable guide for the recovering process. This is it so because therapy helps to provide patients more than just a listening ears. When a therapist, they understand the situations and the conditions that are suffered by the patient, or we call client, they are able to provide personalized strategy or a tailored methods that are suitable to the patients based on the situations or the problems that they are currently facing. This is important because from the personalized strategy, therapists are able to provide guidance which are able to lead to improvements throughout the whole treatment process. For instance, two of the most common methods used are cognitive behavioral therapy and also dialectical behavioral therapy. So what is cognitive behavioral therapy and dialectical behavioral therapy? So cognitive behavioral therapy, CBT, is a type of talk therapy that helps individuals manage mental health conditions like depression and anxiety. Whereas, for CBT, it is usually used for identify and changing the negative thought patterns which influence the client's behavior. So whereas for DBT, which is dialectical behavioral therapy, it is a type of talk therapy that helps individuals manage emotions and improve relationships. So usually DBT is used for those who are suffering with thoughts like self-harm and also those who suffered with suicidal thoughts. So through DBT, therapists will help the patients with emotional regulation and also practice mindfulness. From a study in 2023, it is also proof that these two methods used in therapy has significantly reported is that has significantly make an improvements in the mental health after undergoing therapy. So to provide a little bit more insights is that the percentage of improvements based on the types of therapies are 80% for CBT and 77% for DBT. So that's all from me.
Thank you for sharing that. It really shows therapy isn't just talking. It's a structured, effective process to help those patients to overcome their mental health issue. And finally, Hazik, many people still hesitate to seek help. How does stigma prevent people from seeking mental health support?
Thank you for the question. As we all know, stigma can act as a barrier to accessing mental health. Here are the keys why stigma might prevent someone from seeking help. The first one is fear of judgment and judgment. Many individuals avoid seeking mental health because they are afraid of being judged or labeled. Society often associates mental illness with weakness, instability, or even danger. This can make people hesitant to talk about what they are experiencing, worrying they will be treated differently from another people. The second one is cultural or religious belief. In some cultures or religious community, mental illness is not openly discussed or misunderstood. It might be viewed as a moral failing, a test of faith, or even a punishment. This belief can discourage people from recognizing their symptom as a health issue and stop them from getting professional. The third one is workplace consequences. Another major concern is how a mental health diagnosis might affect someone's career. People may fear being seen as less capable, being passed over for promotion, or even losing their job. As a result, they choose to hide their struggles to protect their livelihood. That's all from me. Thank you.
Thank you, Hazik. I believe that's a strong reminder that our words and attitudes matters. Reducing stigma start with us. Let's continue with you, Hazik. You mentioned stigma earlier, so let's go deeper. In what way does stigma lead to social exclusions and discrimination against those with mental health issues?
Mental health stigma doesn't just affect how people feel. It also often affects how they are treated by others. Uh, Today, I want to explore how stigma can lead to social exclusion and discrimination, and how this creates real barriers for those experiencing mental health challenge. The first key way stigma can impact life is isolation from social network. When someone is open about their mental health struggles, they may be excluded or avoided by friends, family, or even community members. Fear, misunderstanding, or discomfort often causes people to pull away, which lead to loneliness, shame, and withdrawal. Instead of support, many face silence or rejection. The second one is barriers to employment and education. People with mental health condition may face bias in hiring or promotion, or may not be considered fit for certain roles. In schools, students also can be bullied, excluded, or even discouraged from participating fully. This kind of discrimination limits their opportunities despite their low qualification. The third one is reduce access to service and support. Some individuals experience discrimination in healthcare or public services, where their concerns are dismissed or not taken seriously because of their mental health history. Others might avoid seeking help altogether out of fear of being judged, labeled, or mistreated. As a result, uh, they miss out on vital support that could improve their well-being. Thank you.
That insight really helped us understand how stigma affects life beyond just mental health. Wai, earlier you spoke about therapy methods. Now, can you explain why is the therapeutic relationship important in the recovery process?
Yeah, sure. All right. So, first, therapeutic relationship is really important at the recovery process because it provides trust and emotional support. So during the therapy session, therapists use active listening, empathy, and validation to help client feel understood during the whole treatment process. So besides feeling understood, they will also feel valued during the whole treatment process. This is really crucial in facilitating behavioral changes and also fostering trust in the whole treatment process. For example, a strong therapeutic alliance is crucial for individuals who are experiencing suicidal ideation. A strong therapeutic relationship which are established at the early stages can significantly help to reduce suicidal thoughts and behaviors. Thus, a strong therapeutic relationship are important in the recovery process of individuals who are suffering in mental health problem. So additionally, therapeutic relationships are also really important for helping those who lack of a reliable support system. As the previous panelist has mentioned, some of them lack of reliable support. So this is where therapeutic relationships also actually plays a very important role because a strong therapeutic relationships also helps to build trust and emotional safety, which leads to clients feeling comfortable when discussing sensitive and complex issues. This is important because a strong therapeutic relationship is a dependable and also a source of support for them, as it offers a safe environment to practice new coping skills, emotional regulation techniques, and problem-solving strategies for those who are lack of a reliable support system. So as a result, a quality therapeutic relationship enhances client engagement, promoting consistent session attendance, active participation, and adhere to the treatment plans. So I think it is actually pretty safe for to say that therapeutic relationships is important in the recovering process of clients suffering from mental health conditions. Because it is also supported by a research from the National Library of Medicine, which points out that patients often experiencing lasting improvements in their mental health, relationships, and overall quality of life when the therapeutic relationships are done well. That's all from me. Thank you.
Thank you, Wai. That was beautifully said. Trust truly forms the core of healing in therapy. So we're moving on to Justina. Another serious issue today is cyberbullying. How does cyberbullying on social media contribute to depressions and suicidal thoughts?
Thank you, Alicia. So now I'm going to explain about how cyberbullying on social media contribute to depression and suicide risk. Okay, first of all, victims of cyberbullying have a 70% higher risk of depression and increased suicidal ideation. Okay, nowadays, teenager use of social media is one of their apparent characteristics. Being socially connected with other people is a typical phenomenon. Whether at home, school, or even a social gathering, and adolescents are constantly in touch with their classmates via social media account. Adolescents are drawn to social networking sites because they allow them to publish picture, image, and video on their platform. It also allows teens to establish friends, discuss ideas, discover new interests, and try out new kind of self-expression. Users of the platform can freely like and comment on posts, as well as share them without any restriction. Teenagers now frequently post insulting remarks on social media platforms. Adolescents frequently engage in trolling for amusement without recognizing the potentially harmful consequences. Trolling on this platform focus on body shaming, individual abilities, language, and lifestyles, among other things. The effect that result from trolling might cause anxiety, depressive symptoms, stress, feeling of isolation, and suicidal thought to the other people. The the author, uh, sorry, due to the due to the uh, due to the overuse of social media and overuse of trolling, it have it make people being have a negative thought about themselves because they feel like they are not fit in into their norm. So, because of that, additional research studies say that higher level of social media usage were connected with worse mental health outcome, and higher level of social media use were associated with an increased risk of internalizing and externalizing difficulties among adolescents, especially female. This is because it was connected with body image problem and disorder eating due to the trolling. It was also discovered that cyberbullying victimization is connected with poor mental health outcome in teenagers, including an increased risk of sadness and anxiety. The use of social media was also connected with more depressive symptoms and excessive pleasure seeking, but also with greater popularity, as well as appearance comparison and body image worries, especially young women That's all. Thank you.
Thank you for that strong message. It is something that must not be ignored in the digital age, and I believe that this message will leave a big impact to our life. So now, Payne, now that we understand the risks, let's look at the solutions. What strategies can families, schools, and communities use to prevent mental health issues in adolescents?
Thank you for the question. And community, family, and school that often play an important role in helping to reduce the mental health issue among the adolescents. And there are a few strategies that can be used. And first, the community can provide a strong community support, which can help to prevent a mental health disorder among the adolescents. And community support can be strengthened by fostering social connections and providing essential resources which can act as a um, protective factors against the depressions. And studies have shown that there's a positive relationship between the high quality social relationship and subjective well-being across all age. A large and supportive social network can protect the adolescents from depressions, especially those who have faced the abuse and other hardship. And besides that, youth mentoring program can also be one of the strategy to prevent or reduce the mental health issue in adolescents. And in this program, an adult mentor will provide the social support and encourage them to engage in a shared activity without offering a psychotherapeutic interventions. And this program is effective because it can enhance the social and emotional skill and lower the risks of behavioral disorder, substance use, or criminal offendings. And not only that, school can implement a mental health program that include the early identifications and intervention service, as this can significantly improve the student outcome and address the mental health challenge. For example, the routine mental screening and also the counseling service, the teacher training can help to detect the issue before they escalate. And furthermore, the peer support network, mindfulness workshop, and anti-stigma campaign can be held by the school to create a safe environment for students to express themselves. And lastly, leveraging a digital platform to offer accessible resources, psychoeducations, and peer support and connections to the mental health professional can help to reduce the symptom of anxiety and depressions among the young people. So these kind of mental health preventions should be proactive so that can help to support and protect the adolescents from the mental health disorder. Yeah, that's all from me. Thank you.
Excellent. Proactive prevention is truly the best path forward. And finally, Jiwen, earlier you shared the symptom of depressions. Let's now explore the cause. What are the main causes that contribute to depressions?
Thank you for the question. So, depression is a complex condition and it doesn't have just one single cause. Instead, it can be triggered by a variety of biological, psychological, and environmental factors. Understanding the causes help us realize that the depression is not a sign of weakness, but a medicine condition that deserves us attention and care. So let me briefly explain some of the main causes. First, genetic play a significant role. If someone has a family history of depression, their risk of developing it is higher. This means that depression can run in the families, likely due to the inherited biological traits that affect how the brain regular mood. Next, we have stressful life events. Major change in life, like the loss of loved one, divorce, financial problem, or academic pressure, can all trigger depression. This situation create an emotional stress that may overwhelm a person's ability to cope, especially if they don't have the strong support system. Another important factor is medical condition. People living with chronic illness such as cancer, diabetes, or heart disease often face not only physical pain but also emotional challenges. The sense of helplessness or being a burden can lead to a depression too. Chronic pain, in particular, is closely linked to depression. Lastly, medication can also contribute to depression. Certain prescription drugs may have side effects that affect mood. For example, some types of blood pressure or sleep medications are known to influence the brain chemistry in ways that may lead to depression symptoms, especially when taken long-term or without a monitoring. In summary, depression is not caused by one issue alone. It often results from a combination of factors. Understanding these causes can help us approach the topic with more empathy and, more importantly, encourage early help and support for those are affected. So that's all for me. Thank you.
Thank you, Jinwei. Thank you for clearing that up. It is important to know that depression has real medical and situational causes, not just sadness. As we wrap up today's forum, one key message that stands out is mental health is just as important as physical health, and it affects every part of our life. From understanding depression and its symptoms to addressing the challenges faced by adolescents, the impact of social media, the healing role of therapy, and the harmful effects of stigma. Today's discussion has shown us how complex yet deeply important mental health is in our communities. We hope that each of you walks away from this forum with greater awareness, empathy, and the courage to speak up, whether it is for yourself, a friend, or even a stranger. Let's break the silence, reduce the stigma, and build a world where mental health is supported, not judged. Because good health and well being with understanding, and that start with it. Thank you everyone for joining our forum for today, and see you in another forum. Bye bye. Okay, that's all.